Joanne and I are going to basically do what's called a fishbowl, just give you a sense for what this is going to feel like when you're in your small groups. And so the case that I'm going to present is a young child that's presented to the emergency department completely asphyxiated and drowned. You're unable to resuscitate the child, and the child is basically pronounced dead within minutes of being in the hospital. Mother is on her way. And so I will be the physician that meets Miss Holland. Okay.
Hi, I'm Nancy Holland. I heard my daughter got hurt at daycare.
Hi, Miss Holland.
Yeah,
Please
what's
have
going
a
on?
seat. I'm Dr. Elie. Please have a seat.
Okay. Wait, where is she?
Well, she's here, but can
Is
you...
she okay?
Well, can you tell me what they've told you so far?
Just that there was an accident at the daycare. It was like, it's like my friend who referred me to this place. It's not like one of those legitimate... Is she okay?
So, unfortunately, I do have to tell you something that's going to be very difficult for you to hear.
What? Just tell me, what?
So, unfortunately, we found her unconscious in the pool.
Oh, my God.
Yeah.
Oh, my God. She's okay, right? I mean, can I see her? Where is she?
You can see her. You can see her. I want you to know that the paramedics found her and brought her to the hospital.
Okay, good.
And
the paramedics came. Oh, I'm so glad. The paramedics are wonderful in this
We
city.
did everything that we could.
Yeah.
We weren't able to save her. We were not able to save her.
What do you mean?
She died this morning.
No, don't tell me that, no! Oh my God, what am I going to tell my husband? Oh my God, my baby, where is she?
She's here. She's here.
No! Oh no!
I can't imagine what you must be going through.
Brought her there. I knew it was the wrong thing to do. Oh no!
Nothing that you did caused this to happen today.
Oh God!
Miss Holland, I just can't imagine what you must be going through. Is there anyone that I can call?
I need to see her.
Okay, you can absolutely see her.
Yeah, I mean.
We'll make sure you see her.
Oh my God, my husband. How am I going to tell my husband?
We can help you talk to your husband. I know how shocking this must all be.
Oh, God. What do I do now? Can I see her?
Yes, you can see her. You can see her. Okay, we're going to stop there.
Oh. All right.
So let's talk a little bit about that interaction, which was very difficult for me, even with Dr. Kuntz being my colleague. So a few things. What did you all see that was happening there in our interaction that you thought was going well?
You got on her level.
What do you mean by that? Can you be more specific?
I mean, we don't need to pick apart the timing precisely, but essentially as soon as she sat down, you sat down, and you were eye to eye and engaged with her in a shoulders front.
Good. So body language, eye contact, leaning in. She almost fell out of the chair, and just being ready to support her physically, not physically, but just somehow mirroring her reaction. If that makes sense to everyone. Okay. Anything else? Okay. Okay. What did I do specifically?
Well, you asked her what she knew so that you were able to come at it instead of just delivering bad news.
Okay.
Immediately, you kind of ran her through some steps to prepare her.
Okay. What did I say?
What did they tell you?
Right. Right. And so that helps me to understand what she understands, right? So that I'm not introducing a concept that she is perhaps not familiar with, but just setting up the story so that I have enough information to fill in the blanks for her. What else happened that you thought went well? Yeah, so silence is often a very effective method that we use in communicating with patients, and just to help them as they're, or families as they're processing information. Absolutely.
What was, did Carmelle say a lot to me? She didn't, right? Did she support me? She was just present, right? When we're giving news like this that is life-changing, we are in a very sacred space. Like, this woman is never going to forget this moment for as long as she lives. And we can make that a moment that you don't add more tragedy to by being not present, by being distracted, by, rushing off, but by just staying there, grounded in the uncomfortable feeling. Because like she said, this was hard for her. We didn't practice this, and I didn't know I was going to be as ramped up as I was just now. But I'm like, oh, maybe I should try acting. But you have to get into touch with how uncomfortable it is for you, and like your anxiety, you all feel it, right? If we had said this was an 85-year-old from the nursing home who had an aspiration and died, are you really that anxious about it as you are if this is the 3-year-old who just drowned in a swimming pool? They're two incredibly different scenarios, and you have to find the place in you about how am I going to deal with what this is stirring up inside of me, as well as what's happening with her. It's all about the mom, the patient, but you can't take you out of the equation, okay?
So important.
Yeah.
Checking in with your own perceptions and your own ideas of what's happening before you walk in the room, and being careful about what you're bringing into that conversation as well. Yeah.
The other thing I think to remember when you're giving really serious news is to never do it alone. Bring a nurse, bring your chaplain, bring somebody else, because eventually the doctor has to leave the room, and now you've left this woman. Now maybe we're going to bring her someplace else, or maybe they're preparing the baby, or maybe they're doing something. But you want to give a handoff that, I'm going to leave this person with you. I'm still here, but you're not just sort of leaving them in some empty room, which is even more horrible, right? Yeah.
Can you touch on maybe how, because this is just me predicting how I'm going to be, how you, I guess, bottle your own emotions in that, like, in the EM setting where you have to deliver that news in a more tight time frame, you don't have as much time to prepare yourself emotionally to give it without, I know sometimes from the patient perspective, I guess it can be sort of weird if you're also emotional in the interaction depending. So.
I can respond to that. I think bottling your emotions is probably not something that's reasonable, but I think compartmentalizing your emotions, especially if there's a certain scenario that sort of resonates, you should be careful not to bring that into the room with you. So mindfulness was brought up a little bit earlier. Just taking a moment, taking a deep breath, and figuring out how you can compartmentalize some of that is one step. But the reality is that oftentimes I find that my patients and families appreciate when I am just as emotionally distraught by the event as they are. I've cried with my patients and their families, and I don't know that that's ever been considered offensive to them.
Yeah.
I think it's a matter of how much emotion you show, realizing it's about them, it's not about you, and being there to support them is really paramount. It's okay to show emotion, but it's not okay to totally break down.
Right.
Yeah.
And there may be cases in the ED that hit so close to home. That's why you really have to check yourself. Like this case, the reason why I'm able to do this really well is my niece died at the age of 2. And I was channeling what that felt like when she died. And it was horrible. And I have had cases in my career where a young child has come in, and it was just a day that I knew wasn't a great day for me, and I could take care of the kid. It was giving that news to a parent that I knew emotionally I would not be able to get through when it was too close to what happened in my own personal life. And that's why we're all human. We all have our life experience. And you, just like if you don't feel like you have it in you to do that floating transvenous pacer wire on a particular day, or you're trying to do an intubation and you're not getting it, you're going to get someone else to do it, right? You're going to get the most skilled person who has what it takes to get the job done in that moment at that time.
And I will say, here, we all, one of the beauties of emergency medicine is that we work as a team.
Yeah.
And so when you see one of your colleagues, I mean, maybe this wasn't your case, but, one of your colleagues had this case, and you know that they have a small child, and they're going to have to go talk to the parents, or
Yeah.
their parent recently died, and they have to go deliver news. Check in with your colleague.
Yeah.
And say,
How can I help?
how can I help? This must be difficult for
Yeah.
you.
Yeah.
Because the way to survive in this specialty is to actually deal with the emotion and help your colleagues deal with the emotion.
Yeah.
So be a friend and check in
Yeah.
that way as well.
All right.
Did you have a question?
Yeah, sorry. I feel like I've always been taught in these situations to never inject yourself or offer any personal anecdotes or anything. But let's say you're in a situation where you had something similar that happened in your life, or you have to have the grandma needs to be with us, conversation. My grandma's emotional too. I understand how that is. Is there ever a situation where it's appropriate to offer your own I've been through something similar, I know how that feels type of thing? Or do you
If they've invited you into that, if they've opened the door and they've asked you, be careful with that.
Yeah.
I've done it, and I've seen other people do it as well. It can devastate a family. You can actually lose a conversation because you insert yourself or your experience into their tragedy.
Yeah, I mean, you really want to keep it about them, and you really never want to say, I know how this feels, because you do not know how this feels. You are a completely different person than they are. Even if it's the exact same disease, it doesn't matter. Their context of their life is completely different from yours. The one time I do offer things is I'll say in my experience with this, I have found this to be helpful. Like if I want to offer advice to someone about something, particularly when people ask questions about, how am I going to tell my kids? We can find someone to help you. In my experience, these things have helped. Sometimes people will really ask you really detailed questions to help them feel like they have control over something. But I rarely share personal things. Because you're just spending time talking about yourself, and that's not helping anything, right?
Yeah, and so ask for permission. It's very easy to ask. Would it be all right for me to share an experience that I have noticed in another patient? Would that be helpful to you? But yeah, asking permission, or allowing them to invite you into the conversation if you feel comfortable. I always get asked, well, if this was your mother or your father, what would you do? And that may or may not be appropriate for me to respond to.